Hey guys, hey, it's my birthday. It's my birthday. It's not, but okay. Anyway, let's get started today with our lecture. We're still in chapter 13, how to interpret a 12 lead EKG. So these are our objectives for the chapter, and we are right here at number 3 is what we're going to do today. We're going to determine the axis quadrant on a variety of practice scripts. So let's do a little review from yesterday. We talked about the electrocardiographic truth. Okay, so let's review them. Uh, an electrical impulse traveling toward or parallel to a positive electrode writes a positive or upward QRS complex on the EKG. An impulse traveling away from a positive or toward a negative electrode writes a negative or downward QRS complex. An impulse traveling at a right angle to the positive electrode writes an isoelectric complex, or one that is as much positive as it is negative. And if there's no impulse, you get a flat line on the EKG, okay? So our normal QRS deflections leads 1, 2, 3, AVL and AVF should have a positive QRS complex. AVR's QRS complexes are going to be negative. V1 and V2 should be negative. V3 and V4 should be about halfway up and halfway down, and that's what gives you your isoelectric. Okay? V5 and V6 should be positive. Okay, and a review of what those complexes look like. Here in lead 1, we have a positive QRS, it's pointing upward. Lead 2, we have a positive QRS, it's pointing upward. Lead 3, we have a positive QRS. And here's our AVR. Look at it, it's pointing downward, so that's our negative. AVL, look, you got a point going up and a point coming down, so that's your isoelectric, okay? And then AVF is positive with its point going upward. Okay, so let's take a look at this slide. This slide shows the SA node firing. Here's our AV node, and then there's the impulse coming down through the ventricles. Here's just an illustration of a normal heart axis. Okay, axis quadrant determination. So the electrical axis is a method of depicting the direction of the heart's electrical flow. What we know our normal current starts in the SA node and travels downward toward the ventricles, right? And we just showed that on the one of the previous slides. So in an abnormal heartbeat, the rhythm or current may travel in an unusual direction. So look over here, see where our arrows would be coming down, pointing to this quadrant with our normal axis. So again, if it's abnormal, you're going to see it, that current traveling away in other directions, okay? Again, resulting in an axis, meaning the arrow is pointing in different directions. And here's just another little illustration of our firing of our normal pacemaker, shooting down to the AV node, which is again going to pass it on down to the ventricles. Okay, so what are some of the causes of axis deviation? A normal variant. It may be normal for some people to have an abnormal axis, okay? And you may hear the doctor say that's normal for you. Because remember, we talked about everybody's body is different. We're all unique beings, and even though there are a lot of things in common, we also have many things that are uncommon or that's only unique to each individual person. And here I indicated to keep in mind, this is why proper lead placement is so important in helping the doctor determine that baseline. Because when he sees that baseline, and after you've seen that doctor a couple of times, or it's noted, they have a baseline noted in your chart, then he can look back at that and see where he can make that determination with, oh, and based on other factors, your symptoms and everything. He can make that determination that that is a normal variant for you. Myocardial infarction or a heart attack. And we know that dead tissue does not conduct a current, an electrical current. So that current is going to reroute itself around that dead tissue, okay, and shift that axis away. Ventricular hypertrophy. This is an overgrown tissue where you'll see somebody, when you may hear them say that a person has an enlarged heart. So again, it takes more current for that large tissue to make it contract, okay? Arrhythmias, an example of this would be the ventricular rhythms in which you have that current going backwards. So it's pushing back up towards the atria instead of coming down like it's supposed to. Advanced pregnancy or obesity. Oh, I can relate. These conditions physically push the diaphragm and the heart upwards, causing that axis to shift upward to the left. Chronic lung disease and pulmonary embolism. If somebody has emphysema or COPD, you may see these conditions cause the rightward axis to shift because of the enlarged right ventricle. And then I think what's called hemiblocks. And these blocks are of the left bundle branch, in which it causes that impulse to travel in an alternate direction, resulting in either a right axis deviation or a left axis deviation. Okay. So here's an example of the axle reference system, and this shows us, this is like your compass, which shows which direction that axis will be going, okay? And again, if we divided that in 4 quadrants, we see here our 4 quadrants. Okay? So let's do a little review again. What do you need to be able to determine the axis on the EKG? Okay, first of all, you're going to need that 12 lead EKG, okay? And make note of this right here. Very, very, very important, okay? Those leads have to be placed on the patient correctly, okay? So that RA is on the right arm, LA is on the left arm, LL is on your left leg, and not on the chest or the abdomen, okay? That's common mistakes that people will make. They'll just slap those electrodes up there without finding those proper landmarks, and then you get all that artifact in there and you get improper reading. And I promise you guys, if you do stuff like that, you will have some angry physicians at you, okay? Because those tests are, again, you have people waiting for these test results. The doctors are waiting for these test results to make a determination on how to treat that patient. And when they get that and they know that it's the result of you not properly placing those leads, it's not going to be a pretty sight, okay? Just keep that in mind. So if you don't know, then like I said, it's always best to have your little references. That's why I like you guys to make your index cards. And if you don't have any index cards, that's fine. You can use paper. You can fold that paper and, in a way to create little index cards, okay? But it's always better to have you a reference in your pocket, something to refer back to if you don't quite remember or you're not sure, or just to check yourself. It's always better to do these things up front than to try to guess and get it wrong, okay? Because it will have to be redone, and you can cause damage to the patient, because these situations are oftentimes a matter of life or death, or can be a matter of life or death for these patients. You know, if you have somebody in the ER that's possibly having a heart attack. Okay, and then you'll need to have knowledge of the axis deviation. And we're gonna, you will, because we're gonna talk about that, okay? So here with our axis determination, to calculate the axis, we use what's called the hexaaxle diagram. And we'll just refer back, that's what this is, okay? And here's just another image of that, okay? The diagram shows lines depicting the frontal leads, which are your leads 1, 2, 3, AVR, AVL, and AVF, okay? And we see those labeled here. Kind of hard, can't see that AVF down there, but there, it's down there, okay? What we know that lead 1, one's current runs from right to left. And how do we know that? Here we are right here from previous when we talked about lead placement. Here's our lead 1, and there's the direction in which the current's traveling, okay? We also know that AVF runs up and down. And how do we know that? Again, here's our AVF, and there's a depiction of how the current is running, okay? The leads are separated from each other by 30 degrees. You see here, 30-degree increments. And if you draw a circle around that, that's how they get that hexaaxle circle, okay? So here again, the current flowing from the sinus node to the left ventricle would yield an axis of about 60 degrees, and that's a normal axis, okay? Right in here. If you look at leads 1 and AVF, to divide the axial circle into 4 quadrants, there's your 4 quadrants, the normal axis would fall between 0 and 90 degrees. Okay, so we have 90 degrees here and 0 here. And there's your normal quadrant. Okay. Left axis deviation is between 0 and negative 90. Here's your negative side. And I don't know if y'all remember when you did your graph in school and you had the X and Y axis? Well, that's what this is similar to. Okay, you can picture that, your X and Y axis. So here's our negative side, here's our positive side. Okay, so right axis deviation is going to be between positive 90 and negative or minus 180 degrees. And here we see that right here. Okay. The axis is called an indeterminate axis if it falls up here in this area right here, okay, call it extreme right axis. And it's called indeterminate because sometimes they can't tell if it's extreme right or extreme left. But here in this area right here is like no man's land. It is what you do not want, okay? You do not want an axis that falls in this area on a patient because it's not good. Okay, so moving right along. Here again is another image. And y'all, I posted several different views of this in several different ways because different people learn different ways. So you pick the image that speaks most to you, or if you're able to learn from all of them, that's good. But whichever one speaks the most to you, make you a flashcard or make you a reference of that sheet, okay? You know, to keep with you at all times, so to help you to be able to read those 12 lead EKGs, whether you're in clinical or, now of course, if you're having a test, you can't use it as a cheat sheet, okay? So let's look again. If you look at the QRS in leads 1 and AVF to determine the axis quadrant, so those are the 2 leads that you're going to be concerned with when you're looking for that axis, okay? You're not going to be looking at the whole thing per se, okay? You will eventually, but just to determine the axis, we're going to look at leads 1 and leads AVF, okay? What we know lead 1 connects right and left arm. And how do we know that? Because we learned that back with our lead placement, okay? And here again is an example. Okay, so that tells us that the current is traveling right to left. We know that AVF is located on the leg, so that tells us whether that heart's current is traveling up or down. And how do we know that? Here again, because we're going to draw from our previous lessons on lead placement. Okay. So if the QRS is in both leads 1 and AVF is positive, then you'll have a normal axis. Okay. And by what I mean by positive is, remember when we looked at that QRS, if the R is pointing upward, then it's positive. Okay. However, if you have a QRS in lead 1 is positive and your AVF is negative, meaning your lead 1 is pointing up and your lead in AVF is pointing downward, then you have a left axis deviation, okay? And it's abbreviated LAD. So if you see that, that's what LAD stands for, your left axis deviation. Now, suppose you have, in lead 1, you have a negative in which your QRS is going to be pointing downward, your R is going to be pointing downward. And in AVF, you have a positive, which means it's going to be pointing upward. Then you have a right axis deviation, or RAD. Okay. But what if you have lead 1 and AVF both being negative? Then that's where you enter into that no man's land and you get that indeterminate axis, okay? I mean, you can't tell what it is. And so if you can't tell what it is, then it ain't good, okay? So if you look over here at our chart, we see a re-illustration of just what I said. If their lead 1 is positive, AVF is positive, your axis is going to fall here in that normal quadrant, okay, which is your left lower quadrant. If it's positive in lead 1 and negative in AVF, it's going to fall in that left upper quadrant, okay? If lead 1 is negative and AVF is positive, then it's going to fall in your right lower quadrant. And if lead 1 is negative and AVF is negative, then it's going to fall in no man's land, okay, in that upper right quadrant. Okay, and here again is just another recap, another view of everything that I just said. Okay, this is just another view of it. Like I said, pick whichever one speaks to you and learn it, okay? Here's yet another one. This is one that can give you instant recognition of axis deviation. This one may be easier for some of you to learn. I'm particularly a visual person, so I would need this and the circle, okay, side by side to connect the two, but whatever works for you, okay? So this just shows our normal axis with being both positive. Our left axis deviation, we have a lead 1 being positive, and then we have this one is showing, this is actually showing lead 2, guys. So this is probably not one that you would want to use because it's not show, you have to remember if you use this when you're looking in lead, that's lead 2, that's not AVF. So I'll probably just discard this slide because I don't want to confuse anybody. So let's go on to our next one. This one also, you know, when you create these things, you can go back and look at it. As I'm lecturing on it, I'm looking at it and saying, that might be a little confusing to them because of our previous statements. I want you guys to use lead one and ABF. That will be easier for you. Okay. This is a good one because it shows you the circle. Like I said, I'm a visual person. I need the circle and the graph. Okay. So here, if we look at lead one and we see if lead one being positive and we look at AVF and AVF is negative, it's showing us right here where that axis is going to be. Okay. I love this slide right here. Okay. Look down here in our normal quadrant and we see both our QRSs are positive. Shows us right where it's going to be. We look over here and we see lead one being negative and AVF being positive. And there we are. And then we look up here, lead one being negative and AVF being negative, and we see we're now in no man's land. Okay. And here again, we have another view. Like I said, whatever speaks to you, roll with it. Lead one and AVF, lead one and AVF, lead one and AVF. Okay. So let's look at what it looks like on a strip for a normal axis. Okay, and here it's just showing us right here in the circles, lead 1, 2, and 3, and we see that they're all positive. Okay, and if we look over here in AVF, we see our QRS is also positive. So let's see what it looks like if you have LAD or left axis deviation. We see here in lead 1 is positive. And then if we come down here in AVF, we see it's negative. Okay. And what did we say? If lead 1 is positive and AVF is negative, that's where our axis is going to fall, okay, in that right upper. Okay. So here's our rule of thumb. Just another view of the same old thing. Left axis deviation, you have a positive QRS in lead 1. Right axis deviation, you have a positive QRS in AVF. Okay. Now for your assignment, on page 277, you're going to do the axis practice for the EKG, numbers 1 through 5. And then you will do, on page 278 and 279, do numbers 6 and 7. And when you're done, submit your picture and then do the Will Smith dance, okay? And that's all. And I'm so sad. I will see y'all tomorrow, though. Bye-bye.